This is Cognitive Compass.
We're here to inform and support families and caregivers who are living and working in the world of dementia.
I'm your host, Veronica.
And I'm Edith. This is Cognitive Compass.
I'm so excited because we're going to talk about dementia care techniques.
Yes.
And one of the most powerful dementia care techniques is the hand under hand. Can you explain what hand under hand is and also how it can benefit the person living with dementia as well as their caregiver?
Sure. Hand under hand is a name for a technique that was originally developed for use with the blind, which will make sense when we actually demonstrate that. What it does is provide for a couple of important things, the most important being engaging the brain. Mm-hmm. We have a tendency to sometimes think, oh my gosh, I can do this so much quicker, so let me just quickly give you a drink of water. Let me quickly button up your shirt. That doesn't do your brain any good. Right. That doesn't do your brain any good, and it doesn't do me, the care partner, much good, because then I get frustrated if you don't want me to do that. It doesn't give you any sense of inclusion as the person living with dementia. So it's a very specific technique. You really do need to practice it because it's a little bit tricky at first, but once you've got it, you can help someone bathe. You can help someone do perianal care. One son uses it with his dad to go fishing, wash face, dress, feed, drink, comb hair. You can do it with everything. And the benefit is, and let's use eating as an example. If you're using the technique and helping someone eat with that technique, their brain often, regardless of where they are in this voyage, may say, oh, I'm supposed to be feeding myself, and they may actually take over. Using it for helping someone to eat is one of the more is one of the more common times you'll see that person take over. Now, buttoning things and other care. Perianal care is another one where they figure out, oh, this is what I'm supposed to be doing.
Right.
And there's dignity involved, right? There's dignity there.
Absolutely.
So for this demonstration, I'll be the care partner and you'll be the person living with some form of dementia. So I will have approached you from the front, right? And I'm going to say, hi, Veronica, it's Edith. And then I'm very deliberately going to reach toward you, but I'm keeping my hand eye level because your vision has changed now. So I do this, and hopefully you reach out for me because it's a universal, at least in our culture, a universal symbol of shaking hands. So we meet our hands, and it's called doing a butterfly, right? So we'll show that one more time, doing a butterfly. The person living with dementia stays on top, and the person that's helping is below. These two fingers grip the wrist. These three fingers do the work. So now I can help you button your shirt. I can help you eat. We can demonstrate that later. But one more time, I reach, you reach, we flip over, and we're ready to go, right? Now, if the person doesn't reach for you, maybe they're beyond understanding now what that is, the social skills are gone, you still make eye contact. Hi, Veronica, it's Edith. And I'm reaching and you're not reaching, and I'm going to reach and touch you and say, how are you today? And then I'm going to do this. Now, I can also put my hand over yours because maybe you're a little nervous, and it's important. This piece of your hand and this piece of my hand are touching, right? And if I just give a little pump, that will help you relax a little bit. Then I'll take this hand away. But this is just to show you that we're protected, right? So now we're in business again, okay? And I haven't disrespected you. I haven't rushed up to you and just grabbed your hand and started working. That's what we want to avoid.
Right.
This whole thing, once you've practiced it, you do need to practice it at home. Once you've got it down, it's seconds. It's just seconds.
Yeah.
And it is much more dignified and respectful and will give you a much better outcome, peace and calm and centered contentedness than not respecting the person's space and time. Always from the front, always with eye contact, right?
Yep. So basically I go above. Well, actually, you're the person with dementia.
Right,
so
right.
You're on top.
But you're right,
Yes.
right?
But it's these two.
It's these two. And now these three you're going to help me with.
Pointer finger, middle finger,
And
thumb.
Those are called your manipulation fingers. I call them helper fingers because manipulate. And then you're just hanging on to me with this. And I'm going to hang on to you, right? Because I'm a little nervous, so I'll hang on to you. Or not. Or, yeah, there you go. Or maybe my hand's contracted and you can't nicely do that. So what you're going to do is you're still going to support me, right? Maybe you're going to take your other hand and support me, and now you can work with me this way, right? You can use it regardless, is what we're trying to say. But the basics are above and over. Or now you be the care partner, above, yep, yep, and over.
Over, yeah.
Yeah, there you go. The person with dementia is always on top. Okay? Perfect.
Awesome.
So we can also do hand under hand. Oops, I'm sorry. This is why it's important to have things close. Hand under hand. Now I'm going to help you have a drink, right? Have a drink. There you go. Or maybe I'm going to help you fix your hair, or button your clothes, or do perianal care. And again, something like that, at least I get you started, and you very well may take over yourself, right? So hand under hand really can be used for any number of things.
Makes sense.
As more people come to learn about this world of dementia and the important aspects of dignity, right?
Yeah.
Dignity and independence for the person, I think you're seeing more and more use of techniques and strategies and skills that work.
Right.
And what do we mean when we say work? We mean maintain the dignity and the highest level of independence for the person right here, right now, today.
Absolutely, yes. And when approaching someone with dementia, and this is my big important one, is your body language, because it does matter. Approaching them, eye level, not scaring them,
Right.
not coming from behind, with their wheelchair and just pushing
so
them.
important.
Yes.
Right. Yeah.
What are good techniques would you tell someone on how to approach someone with dementia?
Absolutely, especially not scaring them. Our folks, that confusion is always there, even though it may not be severe at this moment. So if you startle someone, that confusion it increases and doesn't allow them to process, oh, gee, that was just Edith banging a door, or coming up behind me and touching me on the shoulder. So always, and we'll even use the way you're seated right now. Maybe the only way for me to get around in front of you is from behind you. So I'm going to start talking. Hey, Veronica, it's Edith. I'm coming up behind you, and I'm going to use the lowest voice possible, right, because it's a good communication technique, and I'm going to come way around because your vision's changed, right? Your vision has changed now. And I'm going to stay about 6 feet in front of you.
Right.
And I'm going to make eye contact, so I might have to squat down if you're sitting, right? And I'm going to wait till we have good eye contact. Then I'm going to say, hi, it's Edith.
Yeah.
Let's pretend for a minute that you're my mom. I'm not probably going to say, hey, Mom, it's your daughter Edith, because Mom might come back with, you are not. My kid's 6 years old.
Yes.
Right? Now, that's one of those examples of absolutely individual, right? Some people want you to remember and say, hey, Mom, it's Edith, your daughter, I'm your oldest, whatever.
Right.
Others, and it all depends on, you must pay attention to your person, you must decide what works best with them. So you come all the way around, you're about 6 feet out, which is essentially 2 adult arm lengths, right? So we're a little further than 6 feet away from each other. And then you introduce yourself always. Hey, it's Edith, right? Or even, it's Edith again, okay? Then you go on with whatever it was you were trying to do. The point is, too, that you maintain the eye contact at the level. So I would not tower over you.
Right.
I would come to the side, squat down, or sit in a chair next to you. Some of it takes pre-planning, right? For me, squatting isn't going to work anymore, so I would need that chair next to you.
Yeah.
Startling is extremely important to not do. There's a pretty hideous story about startling that we won't go into today, but just trust us when we say don't startle our folks.
Because that's like anyone, even if we're not on the dementia journey ourselves, but if someone just came up from behind and startles you, your first response is to jump and maybe swing. You don't know.
Yeah.
So that goes for anyone.
Yeah.
I mean,
there's an example, a dad, an older dad, he was about 90, was in the hospital, and we know that's not a great place for our folks that are in our world. And the nurse, and it's not her fault because she had not been trained otherwise.
Right.
She just walked up to him in the dark and grabbed him by the arm to start to do his blood pressure. And what did he do? When he startled, he hit her.
yeah.
And now we've got a whole nother ball game.
Exactly.
He lost his placement. He ended up, they tried to Baker Act him, which is because he was a danger to others. Well, no. Again, it wasn't the nurse's fault because she had no different training, but with proper training, she would have known to not do that.
Not to startle
And it wouldn't have happened at all.
Exactly.
It would not have happened at all.
Yeah, and that's a good point. Proper training, and it always goes back to that person who did the swinging, right?
Yeah.
Even though it's cognitively, it's out of their control.
Right. It's like,
So-
oh, well, let's medicate them. It's like, no,
Yes.
let's train him.
Let's train the person.
Right, let's train the
less
care team. Right,
medication.
or the family.
Yes,
Right?
exactly. So that's a good point. And then ultimately, like you said, they lost the placement, which is challenging for the family. 'Cause
Right.
Now what? Now where do we start?
Especially when you look at, well, why did they lose their placement? Oh, well, they're violent. They hit someone.
Or they've been Baker acted. And
Yeah, and oh my gosh, and you know way better than I do what a miserable mess that can be to work with.
Definitely, for sure. Now, this is one that when I'm out there speaking to families, including my own family members and friends that have said they're going through this situation with their person in the journey, is getting them to take a bath.
Oh boy, oh boy, oh
This
boy.
is our favorite topic, right? It's probably the most difficult. It's for some reason they're like, I can always redirect my person except when it comes to bath time. What do you suggest?
Again, and I'm probably going to say this so much, people are going to say, all right, already, we get it, move on. 100% depends on your person, okay? So one of the first things, if that resistance starts to build, one of the things we need to remember is that with every form of dementia, the brain is changing. And you may think, yeah, well, that's a big, profound statement.
Yeah.
But what is also changing is the brain's ability to perceive. Touch is a perception. So it can very well be that water striking the body hurts now.
Yeah.
Also, when you walk into a bathroom, it's cold. There's all these things that require me to remember how to work them, and I got this container and this thing they stick in my mouth and it makes noise and I don't remember the name of it, and that stuff over there that I thought it went in my mouth, but then I realized, oh no, it was a different kind of cream that went elsewhere.
Yes.
So what do we do with bathing? First off, we clear everything out of that room, and I do mean everything. So if you've got a smaller bathroom, yay. That isn't necessary for the task at hand.
Yeah.
If we're going to brush teeth, then we bring out the toothbrush and the toothpaste, maybe the mouthwash,
Yep.
right? If we aren't brushing teeth right now, we don't have that in the way. So use only what you need. If the person is having an issue with a shower, a handheld shower can save the day,
Definitely.
right? A good sturdy bath chair. Keep in mind, and people giggle at this, but keep in mind, and you don't have to answer, but when was the last time you showered with someone?
Yeah.
Right?
Yeah.
It's not always just to get clean.
Right.
So that could be a resistance factor. I am guaranteeing you, my father was never going to allow his daughters to bathe him.
Right.
Never.
Right.
Right? My brother would have been a different story, or a male caregiver, right? So what's the situation? You want a good sturdy shower chair. You want that handheld shower. You want preferably unscented because the olfactory senses change, But if the person is still responding well to scent, something that smells nice for them, a liquid soap. And you know what I mean when I say scrubbies? You know, those net scrubbies? Our friend, Dr. Joshua Freitas, taught us that lime green is the best scene. And you can get those in that color. I've got them. And you put the soap, get one in each hand. You want one in each hand and get it going for the person. And then encourage them, you know, just to get going. And then you take care of business as quickly as you can, right?
Yep.
Now, if that doesn't work, then we have to use other things. Maybe you have to come out of the bathroom altogether. And there are some really good supplies, and I think, not meaning to make a commercial here, but I think Johnson & Johnson makes a great big huge wet one type of thing.
Yes.
And if you warm them up, they can be great for a lot of things. Bathing in a tub, you better be strong enough to help your person in and out, and that can be tricky if it's just one person.
Yeah.
So
You went
again,
back to like heating up, and our seniors are cold often.
always, right.
Always
So that bathroom needs to be super
needs
hot.
to be
Good
hot.
point.
Towel warmer
right.
if you have one.
Yes. And for some people, men in particular, they tend to be less stressed if you allow them to keep their swim trunks on or something like that.
Okay.
And that doesn't interfere in cleanliness. It's just a different way to get around the issue, right? So coming out of the bathroom is another technique. Recognizing that our people don't need a shower, bath, or scrub them up every day, right? They really don't. If there is incontinence involved, yes, that area needs to be cleaned. When it needs to be cleaned, it might be multiple times a day.
Right.
And that's where those big things come in handy, those big wipes, especially if you can, again, get them warm.
And the shower.
Definitely. Good music. If you know that there might be some elevated stress or distress, let's get the calming music on that works for our person, right? And of course, and boy, don't we need to teach every paid caregiver this, we don't say, would you like to take a shower now?
Right.
Because what are they going to say?
No.
Nope, don't need one, right? It's time for your shower, and maybe we've got everything ready.
Yeah.
Or time to get freshened up, or let's have a spa day.
Yeah.
Right? Especially if the word shower or bath,
They're automatic.
yeah, that's like, those are trigger words, so we don't use them.
Yeah.
Right? Sounds easier to do than it is to do, so you want to practice. But again, critical is to start ahead of time.
Yeah.
Have everything in its place.
Right.
Use the music. Doesn't hurt to give a little bit of chocolate. Associate it with something nice, maybe just for that time, and recognize that they don't need to have their body scrubbed every day.
And I'm glad you said that, because I've had families say, but he used to shower 2-3 times a day, and it's like, yeah, but things have changed.
Yes,
he gets his shower twice a week, with the exception of the
Right.
incontinence. But he's doing good.
Right.
So
I mean, even as we age, our skin changes, and we don't. We're losing oils.
Yes, exactly.
Yeah. Make it as pleasant as possible. Recognize that sometimes you might need 2 people. Right.
And going back to it being cold, I heard, and I start with the feet, move your way up.
Absolutely. That is a very valid technique. Start with the feet. They're using their little scrubby up here, and you do the foot thing and just inch up, inch up, inch up.
Yeah.
Right? And even though they're colder than you and I might be, make sure that water's not too hot.
Right.
You want to, again, use their gauge on the warmth of the water. And the feet are a good place to start, right?
And you mentioned practice, and I think families who are watching, practice with laying everything out.
Absolutely.
Lay it out, so if it's right before bed, have the underwear and the pajamas, lay that out, the towel, the little spongy thingies.
In order of use and within reach, right? Especially with progression. Especially when we get to what I call the goodbye stage, where you're doing almost everything, or almost everything is being done for the person. You really need everything within hand's reach.
Yes.
Because you can't When you're working with someone, especially bathing at that stage, they're probably in bed. You're going to put your hand on a major joint, usually the shoulder or the hip, and you're not going to move that hand until you're done.
Right.
So you really need everything within reach, or
I
you
love
need
that you said
yeah,
that. Why is that? Why should someone have their
proprioception, right? It allows the person who's being cared for to their brain to recognize where their body is. That's important. Also, it gives you, the person that's doing the care, a way to feel for tension, and you can adjust, and you keep talking. I'm going to wipe your bottom now. I'm going to, does it tickle your knee still? I'm going to tickle your knee. Those types of things. But again, that is a real example of when you probably need two people.
Okay, yeah.
Because it's really quite difficult, especially if they're on their side. Now you've got to roll them over, and that can be a frightening feeling, like, oh, I'm falling, right? You see that a lot.
Yeah.
So that's a technique that needs to be learned.
Yeah, there's so many techniques, especially for bathing, and I think this is probably like the number one, like I said, where families are like, I can redirect any direction, I just cannot get him to bathe. So that's very helpful.
Washing hair, yeah, man or woman, washing hair is a tricky business because it's awfully hard to do if you're not in the shower.
Exactly.
Right?
Yes, for sure.
Yeah. Some families have the sinks with the little hoses still, or like at my house, my kitchen sink has the piece that you pull it out and you can control it. Sometimes that can help. Keep in mind, now you're asking somebody to put themselves face down or turn around and lean back, and that hurt my back.
And, the generation, too, I find, and including my grandparents, they took baths versus showers. So getting the water over their head, it's not something they were accustomed to.
Not at all. That. And some people just simply don't like it. My sister, who's considerably younger than me, she doesn't like water in her face. Yeah. She doesn't turn into the shower and have that water. She just doesn't like it. So she's not going to like it should somebody try to care for her at some point.
Exactly. And
So.
Communication. So this is my favorite, way of describing how I talk to my grandson. I get to eye level. I speak at his pace. The point is, I want him to understand what my requests are. I easily redirect him. And how can we do this same concept with our persons that are on the dementia journey?
You've made such an important point. We have the skills. Many, many people have the skills. Anyone that's ever been responsible for a child has skills that can be translated, amended, refined for an adult. It's important to remember that you're teaching your grandson, and he will progress into developing and increasing his skills. That's not necessarily the case here. We are not really teaching, we're just attempting to maintain dignity and the highest level of independence. So absolutely, you must have eye contact. If you have a naturally higher voice, tuck your chin. It'll shorten up your vocal cords and lower your voice. You may need to speak more slowly. Instead of saying, gee, Veronica, I'm a little hungry. What would you like to have for lunch? Do you want to go out for lunch, or do you want to stay here and make something? I've got
like so much.
And that brain stopped hearing with, I'm a little hungry, maybe. So it goes from that sort of conversation to, it's lunchtime. I'm hungry. Are you? Or lunchtime, let's eat. Right? And that is something that we need to ensure that other people realize. We are not ordering or bossing. We are giving the person what they need, the amount of information they need that their brain can process. That's where communication is through tone of voice versus let's eat, let's go, to let's eat, let's go. I love you.
They feel your stress. They start getting agitated.
They do. And tone of voice is key. One of the things that I've noticed through the years, and I know you have, is the intuitiveness of our people, those living with some form of dementia, increases. They really do. They may see your distress, but they won't recognize that you just had a go around with the male person, right? Or you're internet provider.
Yeah,
I'm trying to think of
yes,
things that
yes.
stress people out. Or that you got there and you had to deal with traffic. They'll see it in you, and they won't recognize that it isn't directed toward them.
Right.
So you have to be quite careful with that. You stop at the doorway yourself. You know, the 3 deep breaths
Yeah.
minimum really do make a difference for you
Tap.
and your person. Yep, you can do that. And then you come in.
Yeah.
We, again, speak lower, speak slower, less words. It takes the brain longer now to process. Show. Let's have a drink. Drink,
Yeah.
right?
Yeah.
And you show someone. Or maybe you hand them their glass, drink,
Yeah.
and you demonstrate what it is you want the person to do. Change your shirt, right? You demonstrate,
Yeah.
use props, if you will. Communication is about bodies now and inference. If I'm sitting comfortably and looking at and smiling is so important. It's one of the, I always think of my mom. She used, if you said hey to someone as a greeting, she'd say hey is for horses.
Hey is for horses.
But if you say hey, it almost forces a smile.
Yeah.
So, hey, Veronica
Yeah.
versus hello, Veronica.
Yep.
I mean, it can be as loving, but the hey
That
forces
smile
the smile.
is that universal
Yeah.
hello. So,
Yeah.
yeah.
Smiling is important, keeping yourself loose, right? If you show tension, it's going to get picked up on. And
Yeah.
again, the inability to understand, it's not directed toward them, right?
Right. And what do you think about when caregivers, it's different, right? We talk to families all the time. We can easily tell them how simple this is, because it really is. That's why I brought up the grandson. But when it's your family and emotions are involved, how do you tell people to turn that off and just focus?
Yeah, one of the techniques we try to teach is to drop that clear clinical wall, we call it, and stand behind it, especially if you're the at-home caregiver. Caregiver, care partner, I use those terms interchangeably. Because you're the daughter, you're the spouse, but you're also the care person, the caregiver, and we will tell you, don't take it personally. You stole my wallet. Don't take it personally. They would say that to anyone.
Yeah.
It's very, very difficult. It's one of the reasons that we sometimes gently broach the subject of having the person live in a different setting.
Yes.
So the at-home care partner can go back to the relationship. I will now be the spouse. I will now return to being the daughter,
Yeah.
right? So what really needs to happen is the person, the yous and the me's, we need to forge a relationship with the care partner, the one we're trying to help and assist, and show them the value of what's going. It's better to have a calm day. Now, having said all that, I'm thinking, that's why I'm kind of stuttering here, I'm thinking of a conversation I had yesterday. Okay, my mother-in-law, who is going to be 92, was talking with her younger sister, who undiagnosed, but she's showing all the symptoms I'm familiar with for Lewy body. Long, tedious story, but my mother-in-law spoke with her sister and her sister's adult daughter, and the adult daughter was very concerned because sister suddenly said, "What do you mean my mother's dead?" Now, I don't have the pre-story, right? How did mother get brought up? And so she wanted, sister, you call my sister, my mother-in-law. And so my mother-in-law said, yeah, she's been dead for X number of years. So what happened, right? Oh my gosh, I just saw her yesterday. How could she? And no, So what we end up having to do with our families, and that particular family, I worked with the nurse in the family and the other health professional in the family. So I was a little startled that they didn't recognize that when their mom started talking about her mother, that they would, tell me about her. Oh, is she the one that we had to go through all the magazines to find the money because she hid her money? Is that the one? You talk about the person, and absolutely try to avoid telling them yet again that the person is gone,
Right.
is dead, because it's going to be the first time they heard it.
They're reliving it every time.
And you're opening up a whole host of, why didn't you tell me? I've got to go to the funeral.
Yeah.
We've got to order. I mean, I've seen that happen more times than not. So I would say to families, please, please, please listen to us.
Yeah.
We're trying our very best to give you the tools you need to have a peaceful, calm day and have a beautiful relationship with your person. And I'm begging at this point.
Yeah.
I'm begging, especially our own families, right?
It saves you peace of mind from going back and forth and answering, arguing, and watching them get emotional all over again. If you just redirect the conversation or talk about that person, like you said, or go into that your person's world, it's not going to hurt.
I was doing a training for a small home health agency. This is a few years ago, and the never argue topic was, we were on that topic, and one of the workers there spoke up with great agitation and said, I don't agree with that. My mother-in-law, who they were caring for, she was at the door last night at midnight and said that she had to get to the airport. Well, I don't agree with that. I'm going to argue with her. I'm going to tell her, no, get back to bed. I said, how did that work for you? Right? So that's when we give the person what they need, and we say something like, oh my gosh, I am so sorry. They call, your flight's been canceled. I am so sorry. And you hear people say, oh, well, but that's not honest. What's honest about agitating her and trying to insist that she recognize she doesn't have to fly when she can't? What she can understand is the flight got canceled. So in your compassion and understanding, you don't need to be right. You need to give her what she needs.
Exactly.
Right? And I hate those silly little terms we use, therapeutic lying and fiblets. That drives me crazy because it detracts from the reality of you're giving your person what they need.
This is true, because you will get that family member like, I cannot lie to my mother.
Oh, please.
So if you use that word, that is a triggering word for that person, and they're like, I won't do it. Instead, I'd rather argue for 30 days, 30 minutes, 30 hours with my person.
Would you give your mother what she needed if she had a cardiac issue? Would you go for the testing then? Would you give her the medication? Would you give her what she needed if she was type 2 diabetic? Then you're going to give her what her brain needs to function at the best level it can, and that's entering her world and using her current logic to diffuse the situation, to reduce her distressed response, right? Do I get too cranky about that?
No, I love it, because there's this gentleman I watch on TikTok. Now we're going like a little bit off, but I watch him on TikTok. He's a caregiver to his father. He has some compassion because it is his father, but he does argue with him. And the dad will say, I want to go home. Dad, you've lived with me for the past 12 years. This is your home. This is my home. Yeah, this is your home. You've lived here. That's your room over there. And it doesn't look familiar. It's not his home.
No, but what a great one, because boy, you get hit with that a lot. Right? But so we need to know, what home are you talking about, right? Are you talking about your childhood home? Are you talking about your first married home, presuming that there has been more than one home, or now your retirement home, or your placement setting, your healthcare setting, that is your safe home, right? And very quickly, so we don't get too far off the track, one way to address that, particularly if the person living with some form of dementia is in the care partner's home and in the adult family member's home. But it can work if they're in assisted living too. You can say something like, okay, I know you don't want to be here. I understand that, but I am just exhausted, or I have a blinding headache, or whatever else your person would find plausible. So I really just need to lie down, or I really can't drive, or maybe my blood glucose is falling. I can feel it. I've got to eat. So I've looked around. No, this isn't where we want to be, but it's clean, and the people here are friendly enough. So can we please just wait until tomorrow? And often that will work, because our person still has the capacity for compassion if we dig a little bit and get it in there, right? I remember one time fussing over how I looked. I was at a different person's house, and we were doing something like this. We had to take pictures, and as I've already said, cameras kind of freak me out, right? And so I was fussing about how I looked, and I don't know. And there was a person there who was probably easily midway through a journey, young onset, midway through. And he came up to me, recognized my distress, and he said, "Now listen to me. I'm a guy, right?" "Yes, you are. You look fine." His compassion was showing, and I was truly distressed. I didn't want to take my picture. I didn't think I looked good enough to take my picture at that point. And he picked up on it out of all the so-called normal people. And he comforted me. And so I got, "Edith, get over yourself, shut up, stand up, take the picture, call it good," right? But the point is, our folks have the ability to intuit, they have the ability to remember how you made them feel. Yep. So tomorrow I might not remember the argument, but I know you argued with me.
Yep.
I have, she makes,
there.
Yeah. So that's why it's so important to avoid so many things, because it's much easier to avoid and work with the calmness than it is to try to bring somebody back from a distressed state. Does that make sense?
Very much so to me. Now, this is a unique one. I helped a nurse place her mother in memory care. Her mother needed something comfortable, comfy, soothing. Mm-hmm. She was adamant that she did not want her mom to hold a baby doll, and she made sure to tell the memory care director the same thing. "My mom is not like these people. She does not need a baby doll." But she walked in like the first week of the mom moving into memory care, and she found her completely calm in the corner by the window with the baby doll, and it visibly upset her. Could we talk about the benefits of anything that's soothing, including a baby doll for our people?
You're describing my grandmother and my father. He was absolutely, horrified's too strong a word, but he just didn't get it. He was disgusted. And I did my best to explain to him with compassion of the loving daughter. And finally I got down to knock it off, stop being his daughter, be the instructor, be the one with the technique. Mm-hmm. And I said, "Okay, let's put it this way, Dad. I'm going to be real blunt with you. That's what she needs. You are the one that is capable of understanding what's going on here. Mm-hmm. That's what Grandma needs to be comfortable, to be happy, and the best she can be right now. Yeah. So if holding that baby and calling that baby by your name helps her, then you should be grateful."
Right.
And so sometimes we have to be a little firm with our family members, especially those that come out of the healthcare field. And keep in mind, my daughter's a nurse practitioner, but sometimes nurses will just make you crazy, won't they? And I know you're married to one, right? Yes. So, but they just want to help so much, and they're locked into what they know. So let's increase what they know. And it's, one of our local assisted living facilities that I'm thinking of. When I go in there, I often see people with stuffed animals, or they call them plushies. Some people call them plushies. And I remember talking with one of the residents saying, "I just love your kitty." She's like, "Isn't she beautiful?" And it was a good moment. Yeah. It was a good moment. So what our people need, it can be not calling yourself by their familial name, right? "I'm not your daughter. I'm not going to call myself your daughter." It can be giving them a bath outside of the bathroom. It can be telling them the flight got canceled. And it can be providing them what helps them be comfortable and feel productive. One of the things that we've done in the past is when it's been a nurse, right, or a healthcare person, we give them a clipboard with a checklist. So they go along and check things off instead of following the other nurses trying to pass meds and somehow violating some confidentiality there. So you give them what they need. I had a question about a physician who's living in an assisted living, and they're having some real issues. It's like, well, get him a stethoscope, give him his own chair, and have him see people. And oh my gosh,
Yeah.
You know, and it was a benefit to both because those folks that he was seeing understood that they were helping him.
Exactly.
Right? So
Yeah.
it comes back to know the person, know what works, and do it for them.
Exactly. I
And
love that.
honestly, what is the harm in someone holding a plushie or a stuffed animal
There is
or a
no
doll?
harm. Exactly.
You know, what
if
is
it's
the
making them
harm?
happy and
Yeah.
calm, allow
Instead
them to
of
be happy.
the other ALF I walked into, the woman sitting there, the resident sitting there just crying, and it's, what's wrong? How can I help? I don't know. She was just lonely. And if a baby doll would interrupt that
Exactly.
loneliness, then give her 10 of them.
Yeah.
You know,
Exactly.
look, you've got this little school you've got to deal with now, you know.
Exactly. Find that happiness. Edith, thank you so much. I think I'm having fun with this.
Oh, me too. This is wonderful.
I think this is awesome.
Yeah.
I think these dementia care techniques will definitely benefit our audience. And I mean, we have so many stories we can share just on this topic alone. But, you know.
We can talk forever, you and I.
Forever. This is like a fun conversation.
It is. It is. I just hope it's helpful to people and they realize it comes from experience between the two of us. We have decades of experience and compassion for the person not only living with the illness, but the care partner too.
Exactly. Thanks for watching.
Take care.